Welcome to the Vantage Fit Corporate Wellness Podcast. This podcast is sponsored by Vantage Fit, the all-in-one AI-powered corporate wellness platform developed by Vantage Circle.
Working a job is the most important thing in everyone's lives. We cannot sustain this world without having a job. However, many people face significant stress in their workplaces due to deadlines, workload, and whatnot. So in such cases, it also affects their health, both physically and mentally, which we refer to as workplace stress. We'll discuss more on this topic of workplace stress in today's episode of Vantage Fit Corporate Wellness Podcast. Today we have with us health and wellness consultant Debbie Bellenger and corporate burnout coach Teany Hidalgo. Welcome to the show, Teany and Debbie.
Thank you.
Thank you. Nice to be here.
We are so glad to have you guys here. So let us start with our first question. So Debbie, should we start with you then?
Sure.
Okay, so the first question is, Debbie, tell us about your journey in the field of wellness.
Yes. So I have been working in health and wellness for 30 plus years. I started in the fitness part of the industry as a group fitness instructor and then fitness coordinator, fitness supervisor, and on up to director. My wellness career took off when I became the director of wellness for a hospital system in South Carolina, and then director of wellness for another healthcare system in North Carolina. And in those 21 years of work, I was able to basically create customizable employer wellness programs for our own company, our own 7,000 plus employees, local employers, community groups, churches, schools, that kind of thing. At the same time, I was learning the difference between fitness and wellness, overseeing a fitness center that became a medical wellness center because we created wellness programs for our patients in the healthcare system. And that was incredibly fun to do for all the special populations. And at the same time, I was able to learn on my journey about community wellness and the needs of wellness programming for churches and groups and other folks out in the community that had a general interest in being healthier. So in my 21 years at the two hospital groups, I feel like my career was transformed from a fitness expert to a health and wellness expert. And then I went on to the South Florida Y to be the senior vice president of healthy living. So I'm very blessed. I have had an entire career of creating wellness programs for different audiences with the foundation that the programs are designed to improve health outcomes and to make people feel better, move better, all of the things, right? So I've been very fortunate. So in essence, that's what I've been doing in my career, in the work, serving different sectors of the population, so to speak.
That's really inspiring, Debbie. So now moving on to Teany. So tell us, Teany, what is your experience like? How long have you been in the field of wellness?
Sure. So first, I love hearing Debbie's story because I love how we've come from different aspects of wellness to meet together and to create something together. So it's lovely to hear it again. Mine is a bit different. I've actually been working in corporate for 22 plus years, and it took a huge moment in around 2007, 2008, during one of our peak recession times, right? Where I felt just an enormous amount of stress and, physical pain, mental pain, all the things working in a big corporation since I was working for the big company, IBM. And that kind of launched me. It was a catalyst for me to starting to understand myself, my wellness journey, like what was going on with me, why all these stress and, major pivot point moment was happening. And so that kind of prompted me to take some time off. And I just started, going through some introspective moment of, what am I going to do with my life kind of thing? This just can't go on. And I think that is so relatable right now to so many people because of these last couple of years of kind of insanity. So, but for me, that was in 2007. And so that launched me into looking into the area of wellness. And that moved me to go into massage therapy. So I actually started learning about massage therapy, and I opened up a practice in about 2009. And from there, that kind of spawned different, facets of wellness. So I started talking to people that, I was giving therapy to. I started getting into medical massage and getting really deep into sort of the physical reasons, but also like the mental reasons of why people were going through the things they were experiencing. And what I discovered is that a lot of the physical ailments were actually, catalyzed by emotional, mental things that were happening in the world and in their lives, in their relationships and all the things. Because I always say like massage therapists are like hairstylists. Everyone tells their business to massage therapists, right? So same way that people were telling me all their business while they were on my table. And there was such a strong correlation between the things that were going on in their lives and the physical ailments they were experiencing. And so that, moved me into life coaching and into the area of mental health. And of course, move forward to today, I've been doing that for over 10 plus, actually 11 or 12 plus years now. And more now kind of mixing together and supporting people to understand the mental and physical correlations of why they're going through stress and burnout. And so it was kind of an obvious transition to get into stress and burnout coaching in particular because of everything that's been happening in the last few years, and opening up a practice around that area. And then obviously working with Debbie in the wellness side of what she's experienced and sort of forming something together to help people in corporate, to help entrepreneurs. And in particular, I have a big heart for women who work in business and in corporate. So that's sort of my story.
Like both of you guys have a really long experience in this field, right? Yes. In fact, just like you mentioned, Teany, so the physical wellness and mental wellness are very much correlated, right? If, for example, if I'm mentally not well, if I'm depressed or stressed, definitely my physical well-being is also going to get affected, right?
Absolutely. Mm-hmm. And so on the reverse of that, one of the main things I tell people is if you're in a rut, if you're having like a emotional moment, get up, right? Use your physical body to support you getting out of that mental state, because your physical is actually one of the first ways to start changing your energy in your body and in your mind.
Exactly. Okay, so now moving on to the topic. So today we're discussing about workplace stress, right? So tell me, what do you mean by workplace stress exactly?
Okay, so I'm going to start this one because I love talking about stress and burnout because I think people think they're the same, but they're not, right? Burnout and stress are actually very different. Stress in and of itself isn't actually bad. And in fact, small increments of it can actually be really good and be a catalyst to push you. It can protect you because it boosts you with adrenaline and things like this, but in small increments. When we start doing that too much, right? Like over a prolonged period of time, that's when we get into stress, and that's what causes disease. And obviously there's a lot of factors that contribute to stress, right? It can be workplace, it can be, environmental, it can be relationships, there's a whole lot of factors. So workplace is only one of the things that actually contribute to stress. And so I just wanted to note also that, it's very interesting how it also leads to specific symptoms, right? So things like anxiety, and anxiety in particular right now is starting to be seen as a mental health disease or condition. So I think there's a lot of light being shed on this idea of burnout and some of the symptoms that are caused by prolonged stress. Debbie, I don't know if you wanted to add anything else to that.
No, I think that's perfect, Teany. That's perfect.
And especially in today's world, all of us are busy, like achieving deadlines, rushing. Our life is in a constant rush, right? So in this time, especially like even in our workplaces, all we do is running after deadlines. So this automatically gives us a lot of stress. And even like from my personal experience, I can also say that sometimes the workload gets into me, and then I lose my mind and then have panic attacks and whatnot. Yeah. So
absolutely.
So, like, what are the signs of stress in the workplace?
It's funny because I think we've all had, right, so many of those stresses. And I don't think it just happened in the last couple of years. I think we've probably been experiencing them for quite a long time. But if you look at psychology today, there's actually 5 major signs of stress. And there's different levels of that, right? So the 5 are 1, excessive fatigue. And I'm sure we've all experienced some elements of that, right? Like sometimes we're tired at the end of the day, things like that. But it's not just like I mentioned that, burnout is like stress over time. Fatigue is not just, oh, I'm fatigued today. It's also excessive fatigue over a period of time. So I always say, like, if your cup of joe is not, working for you anymore in the mornings and you're still feeling exhausted, then that's a sign that you've already crossed that line of being like a normal and small increments of stress and fatigue versus like long term. So that's one of them, excessive fatigue. The second one is seeking unhealthy escapes. And I've seen people do this a lot, right? Like whether it's excessive gaming, excessive sleeping. And I mean, there's so many different, ways that you can go a little bit overboard. But once it becomes unhealthy for you, i.e., it takes away from your day-to-day activities. It's not a mindful activity anymore. Now it's like excessive. That's when it becomes unhealthy because now you're escaping from your life instead of just enjoying, let's say, a pleasurable game every once in a while to just for fun, right? So that's the second one. The third one is sensitivity and mood flopping. And I mean, I've seen this at home. I've seen this in the workplace. You can see this in a lot of places, even like when you go to restaurants, people just, flip. They're not, their normal selves anymore. And it happens easily, right? It's not something where it's like, oh, okay, this person bothered her or him, over a long period of time. Okay, cool. They're okay. It's when it's like they snap at you, right? It's a constant sensitivity where it's not normal anymore. And you can see where I'm going with all these signs, right? It's no longer like, oh, it happens every once in a while. No, it's like it becomes a consistent pattern. It happens erratically and like quickly, and they're brought on by not just one thing, but maybe multiple things, right? That it causes you to flip your mood and be hypersensitive. So those are the things that we need to start looking at. So that's 3, sensitivity and mood flopping. The fourth one is numbness or disconnection. And that can be coupled with unhealthy escapes, right? So excessive drinking, places where you just want to disconnect and you're not feeling like you want to be here anymore, right? Numbness to doing anything in life, not wanting to wake up in the morning and things like that make you want to disconnect from your life and from connection with people and things like that causing you to become numb or disconnected from your life and reality. And then the last one is your loss of spark, which I'm a huge fan of talking about, being connected to your purpose and to your passion. And for me, this is like one of the big ones. Because once you've lost your interest in your work, in the things that you love to do in your life, that's when things are really going downhill, right? You're maybe just doing the minimum at work, not really engaging, maybe taking more excessive sick days than normal, or at worst case, not even showing up to work at all, right? It kind of reminds me of the movie The Office. You guys remember when he just stopped showing up?
The Office, like the TV series, right?
That was pretty serious, yeah. I mean, obviously there were other reasons why that was caused, but you get the idea.
Yeah.
That big loss of spark is important, yeah. So those are the 5.
Yeah, when you are saying about the science, so I can also, I think, relate to you some of the points that like maybe in the past there were times when I did not feel like working at all and I was just doing the minimum, like what I had to, just coming to office, then going back home, and had no interest in doing anything. So I guess that is one of the reasons, like signs of stress, right?
Absolutely.
So when we're talking about signs of stress in the workplace, okay, so the next question was like, what are the 5 causes of stress in the workplace? So are they similar or the causes are a little different from the signs?
Yeah. So I think that's a good question, Dipshi. I think, we look at, as Teany referenced, pre-pandemic state and post-pandemic, right? And from my lens as a health and wellness professional, and Teany and I share the same philosophy, is that the idea that our health and wellness, our lack of health, our bridge over to sickness, that's an individual responsibility, right? And so I think when we're discussing causes of stress in the workplace, the first part of the conversation that we would begin with is, where are you, the person, in that conversation? So the 5 signs that Teany is referencing, the excessive fatigue and seeking unhealthy escape, mood flopping and numbness, you want to disconnect. I think in all reality, post-pandemic, this is a lot of the world. I read a study this week in one of my fitness newsletters, and the American Psychological Association, this is last week, they do a Stress in America survey. And just last week, they reported that the nation has been deemed to be in survival mode. And so there's this recognition now that the pandemic has impacted all of us in some way, shape, or form, right? So whatever we had going on prior to the pandemic probably has come forward with us and may or may not have become more escalated or more of a problem. Some of the statistics I've seen along with this survey that came out last week, one was 87% of U.S. adults feel overwhelmed by the constant crisis of the last 2 years. So it's an individual thing and it's organizational. They also reported in that same study that 80% of Americans now report negative emotions, anxiety, anger, and all of it is this prolonged stress of the unknown, this thing called the pandemic that kept changing over time, right? We've gone through so many stages of all of these iterations of the pandemic and the Omicron and the fourth wave and all these things. And so within the workplace, whatever individual stress we brought into the pandemic, now we've layered on another potential degree of stress organizationally within our workplace, because many of us had to adapt to a work environment that completely changed. So before the pandemic, 1 in 67 Americans was reported to be working from home. The most recent study I read on LinkedIn was 1 in 6, 1 in 7. So just that transition alone, organizationally, where employees were in a routine, comfortable going to work, commuting, dressing for work, all the things that we used to do to get ready to go to the office, effectively changed in a heartbeat. And then it was, now we have this added organizational stress of, well, everybody's going to stay at home for a little while, and we're going to have the work from home transition stress. We're going to have internet connectivity issues and getting computers to everybody. This was early on in the pandemic, right? But as we've gone through this past 2 years and a little bit more, the organizational stress has changed. And so now we're talking post-pandemic almost about return to work stress. And so for folks that have become accustomed to working from home and maybe like it like that, I know for a lot of introverts, the work from home has been very comfortable because it's more suitable. For me, I'm an extrovert. I'm a fitness, health, and wellness person. I love people. I miss going to work. So for me, my stress is actually not being able to be with my people, right? I want to go to work and see people every day because that's where I garner my energy. So all of these things that corporate America has had to adapt to, working from home, all the tech transition around that, accountability, logging in, time checks, some hourly employees are being monitored very closely. That's causing stress for some when you have to clock in, clock out, every minute is documented. I think a lot of us have encountered both individual stress and organizational combined in us mutually finding our way with our employer what a work-life balance actually means, right? So as an individual, I have to be responsible to say, I don't want to work 12 hours. So if my employer is demanding it, I need to learn to have a crucial conversation, to Teany's point, to recognize that it's too much and I don't want an actual full-blown diagnosis of a burnout, right? Mm-hmm. So I think all of these things post-pandemic, both at an individual level and organizationally, you combine all of that, and that's combining this mutual sense of stress where 80% of America is reporting feeling overwhelmed right now. Mm-hmm. So it's a blend of both, and we have to find our way as individuals to own our own state of health or lack thereof. So I'm a big proponent of individuals. It starts with the individual, recognizing limits, what's healthy boundaries, that kind of thing.
Mm-hmm. I think the COVID has changed everything. Like people got too much comfortable while working from their homes. And when it was time to rejoin offices, like all of them were struggling. So once they joined the office, they took a lot of time, and many are still taking a lot of time to adapt to the new workplace scenarios.
Absolutely.
And this is eventually leading to stress, anxiety, and whatnot. Yes. So what are the various types of work stress, or what are the types of stress in general?
So, yeah. Well, one, I wanted to add something because I think it contributes to both of these, the question that you just covered in the work stress. Change, right? The unknown is a big deal, from any perspective, personal, relationships, work. Humans don't adapt to change that easily, right? We're very cozy and comfortable people, and we like things to be easy, right? And so I think one of the big things in all the levels of stress and all the types of stress is the level of unknown and the inability to know what's coming, right? So whether it's at work or at home, you don't have a sense of stability, that throws everything off, right? So when you're talking about work, in work, out of work, a hybrid schedule, right? How many hours are you going to be working? One of the big things that has come up in terms of stress is the difference between working from home and working in an office is that in the office, you have a typical, quote unquote, work schedule, 9 to 5, et cetera. And you have your, commute time and your, whether it's morning or in the afternoon. When you're at home, it's been really stressful for people because there's been a blurred line between starting work and ending work. Where is your work, right? Is it in the kitchen? Is it in the, do you have an office? Is it both, right? So one of the things I talk a lot about is segmenting, right? Making sure that you have a hard start and a hard stop where possible. Having, a space. And even if you don't have a space, if it's a conjoined space, I work from the kitchen a lot, and I love working from the kitchen because I just love the access to the space where a lot of people are, just to the point of Debbie, I love being around people, right? So kitchen is the place for me. But when I'm done with work, I close my laptop and I put my stuff away, right? I don't look at it. I don't think about it. I transition, right? And that's the thing. People need to start learning how to change by learning how to easily transition from one thing to another. And that's something we can do in the environment, right? We're in, right? At home, at work, and relationships and all the different things. So I don't know if you wanted to add to that, Debbie, but I think that's one of the big crucial things.
Yeah, I think you're exactly on point, Teany. Workplace well-being is very much predicated upon knowing what your day-to-day is going to look like and scheduling, right? I think that's paramount. Having the healthcare experience that I do, and thinking about the nurses that I used to work with, and, when you start changing people's shifts and schedules and assume that they were working the first shift 7A to 7P, and now there's need to work the second shift, that is not a simple ask of someone, right? It's a whole change in their day-to-day, which implicates not only them, but their family and possible childcare issues and school drop-off and all the things that go around our day-to-day life. And so I think Teany's hit on something very important there. Employee well-being, the known part, if you know what your schedule is, you kind of know what your day looks like, that sense of comfort and having that is huge. And I think it's even more important now, to your point, Dipsy, is, as you said, post-pandemic, having that sense of stability and being in our comfort zone, we're all chasing that. And it's the simplest of things sometimes to make things feel normal. Again, the best we know how is having that routine day in and day out. This is when I start my day. This is when my work day begins. This is when I shut down my computer. Now I've got rest and recovery time and family time and outdoor time and all those things. I think that's really, really important in the well-being of employees. And then within that, giving employees the autonomy to have a little bit of flexibility in their day too. Because if you're go 8 hours a day without taking a breath, the other side of that is not health either. Mm-hmm. So I think that's important. Yep.
Mm-hmm. Breaks are like definitely important. And like when we are working from home, like when we were working from home, the schedules got messed up, right? So like, for example, me, I was getting up at 11 o'clock in the morning and then I started working until late night. So entire like life schedule changed. So when we joined offices, then our routine came back to normal. So yeah, so that's what I was saying. Then work from home has actually changed a lot of things and people are struggling a lot like in recent times to adapt with that.
Absolutely.
And this is eventually leading to like employee burnout. And even I think during work from home also people were working. There were many people who did not like to work from home. They were suffering from, they started developing anxiety and depression because they had to work in isolation, social isolation. So like how is burnout linked to workplace stress?
Well, I think one of the things that Debbie mentioned is true, right, about our personal philosophy of self-responsibility. So there are definitely things, all the things that we've been talking about the workplace changes and lack of stability and all these different things are definitely linked to burnout, but it's not the only thing, right? Burnout can be caused by work. It can be caused by, relationships. It can be caused by home environment. And there's so many different aspects. So to what she said earlier, it's one of the things that we need to do is look at all the factors in our lives, and everyone is an individual, right? So there are different elements and different percentages, right? So work can be maybe 30% and relationships can be 50%, right? You don't know what that is. So it's really important to just look at your lifestyle, which is one of the things I talk about a lot and that Debbie and I talk about as well, in terms of looking at how you live day to day. How do you wake up in the morning? What is your daily schedule, weekly schedule, monthly? Are you taking some time off to decompress and fill in again? How is your relationship with your kids, with your family, personal love relationships, right? Like all these things are really important and are all contributors to, the solution, right? To support you getting out of burnout and out of stress.
And like when we are talking about burnout, what are the various ways to combat that burnout? And how like employers can play a role in that? How they can identify when their employees are suffering from stress and eventually leading to burnout? How can they prevent that from happening?
Teany, do you want me to start with the employer part?
Go for it,
Yeah. So I'll speak to the employer part, Dipsy, and Teany will tackle the strategies to combat burnout and stress. So I think for employers, employee well-being, employee wellness, employee engagement, employee satisfaction, all of those things live and breathe in the human resources department, right? And I do believe I'm hoping the positive outcomes of the pandemic is a heightened awareness and appreciation of health and wellness, which I'm seeing in everything that I'm reading, translated to corporate America being more interested in employee wellness. So when we talk about employers identifying how to know employees are suffering from stress, you can lean into, and this is difficult, but Teany touched on a few things. So if I am a team leader or I'm a director or I have a group underneath me and I'm responsible for a team, I would own the responsibility of looking for behavioral change. So one of the layers could be, I'm going to start to notice changes in behavior of my team, and they're just acting differently. Like Teany said, they're snappy, they're coming into work late, they're getting on to meetings late, there are no shows, they're not meeting deadlines, their affect is really different than the person you know. Suddenly, Debbie's not happy at work anymore. She's very quiet in meetings. She's not engaging. As a team leader, there's a responsibility there for me to see that my team is exhibiting behaviors that are basically red flags to something's not okay, right? It could be increased PTO days, increased sick days, all those things that are going on. At a more clinical level, if HR wanted to and or is tracking, and many HR companies do track this because it's part of cost management technique in corporate America, depending on how sophisticated the employee well-being program is, there could be dashboards where there is monthly operations meeting and conversation of tracking the number of sick days across a team or an entire organization. And so you see sick days escalating. Clearly, that's an indication of something, right? So then you have to start to dig in a little bit. It could be HR getting the pharmacy reports, the medical claims reports, and seeing that the number of emergency visits has increased exponentially. The number of prescription meds for depression, anxiety, eating disorders, all kinds of things. Once you start digging into those kinds of reports, the medical claims costs, the pharmacy spend, ED visits, doctor visits, those are very revealing that there is something to be recognized and discussed regarding the wellness of the workforce, right? So I think you have to be open to that and paying attention, but I think you can approach it in two different ways, both behaviorally, watching for signs and symptoms of behavior change, and then in a more clinical sense, where healthcare spend is going with different metrics and the usage of EAP quite probably as well. So I'll hand it off to Teany to tackle ways to combat burnout and stress.
So what are the various ways to combat burnout and stress?
Okay, so I think Debbie started talking about that a bit from the business side, and I guess how employers can support and can tell the signs and things and such. I can talk a little bit about how individuals can do that. I have a whole program basically dedicated to that. And I basically talk about it from 3 pillars: simplify, amplify, and fortify. And simplify just means to look at your lifestyle. And I talked a little bit about this before, but basically looking at your lifestyle overall and seeing where you can cut things out that don't need to be there, that add added stress, right? And really just going back to the basics. What are the things that you absolutely need to have in your life right now at this moment that don't add extra stress, extra fluff, and that don't, contribute to your personal burnout? Mm-hmm. And there's so many things that we can do, right? So many basics that we can add. And that couples with the amplification piece, which is the second one, which is what are the pieces that we can bring back? So first cut out things and then bring things back in that allow for peace, joy, and high energy, right? Things that are not going to exhaust you, but actually add to your life. And I know Debbie likes to talk about wellness a lot, but simple things like, drinking more water, having more time of peace, meditation, mindfulness. One of the big things I talk about from a work perspective is having 10-minute breaks between meetings so that you can decompress from the previous meeting and start prepping for the next one, right? Another thing is taking time outside of your office, outside of your room, workspace, whatever that is. Before we used to talk about how smokers used to take breaks, right? Like 10, 15-minute breaks. Well, there's also like just, mindful and wellness breaks that we can take, health breaks. And just 10 minutes outside just to take a breather, fresh air, put your feet in some grass, whatever that looks like for you, is super important. So things like that can add and contribute to your day. I personally have a full routine in the morning and in the afternoon where I prep myself for the day and energize myself through some physical activities and also mindset. And then at the end of the day, I decompress through journaling, giving gratitude for the things that I did today, for the things that I accomplished, and for the people in my life and all these different aspects of me and my lifestyle. So there's definitely things that we can add that are small, that don't have to add another hour to your day, but it can be like 5-10 minutes. And then the last piece is fortifying. And I'm a huge proponent of community. And I think that's going to be really critical, especially as we start reincorporating into living, right? Humanity, connecting with others and things like that. Really finding the community that, can help you in your environment, whether it's work or personal, but also that can help, ease your anxiety. So bringing in practitioners that support your lifestyle, whether it's a psychologist, a coach, people who are specifically in wellness that can help your physical wellness journey. All those things are part of your community. And so creating it and then creating it so that it fortifies your personal lifestyle is going to be really, really critical. I think more and more we're going to start reaching out to people and connecting with people that resonate with what our values are, what our beliefs are, and what lifestyle we want to create. And I know Debbie, that's kind of how Debbie and I found each other. We sort of connected and we resonated so much on so many levels, and we started forming our own little community, right? So I think that's going to be happening more and more.
Okay, but then one thing, like when we talk about communication, connecting, so what about the introverts? For example, there are many people, right? So when it comes to extroverts, it's easier for them to communicate. But when it comes to introverts, they're most likely to keep their stress or whatever is bothering them inside within themselves, right? So when it comes to them, what are the ways for them to open up about the stress or whatever they're dealing with? Yeah.
I think, there's different levels of introversion, right? I don't think there are introverts that completely talk to no one, right? Like one of my sisters is actually an extreme introvert, and she still reaches out to people, even if it's online, right? So there are communities where you don't have to see people in person or even pick up the phone, right? There's communities online that you can reach out to, that you can seek support through, and that, you can kind of create and build that kind of, there's a community of introverts as well, right? Like there's so many things that you can do that don't involve like physically seeing anyone. I don't know if you have more to add to that, Debbie.
Well, I think that's a really good point. I think it's just different ways that folks manage stress, whether you're an introvert, extrovert. It's like you said, what is it that makes you happy in your day? And I think half the battle is figuring that out. And if it's for an introvert, having one best friend versus 3 or 4 besties, that's good, right? It's okay too. Yeah.
Yes, as long as they have someone to like open up to and express themselves, right?
Absolutely.
Yes.
So like when we are talking about employers and workplace stress, so these days, like every organization and companies are for prioritizing employee health, because at the end of the day, they know that employees are the main assets of the organization. And as long as they are well, their productivity also reaches their peak, right? So if the employees are at a very low point where they're dealing with stress, so ultimately their work outcomes are not that effective as well. So as a result of this, corporates are coming up with wellness programs. So do you think those wellness programs have the ability to help with stress?
I absolutely do, Dipshy. I think the key right now, post-pandemic, is to reset, not assume that anything we did in employee wellness programming prior to the pandemic makes sense anymore. There is a complete reset needed. And for me, it's employee choice and employee voice. And so I think creating infrastructure for employees to come together, to have open conversation around what it is they need, what it looks like, what feels good, what doesn't feel good, how they participate, what they participate in, benefit changes. We're not in the same world anymore. And the whole way we program is so very different now. And having employee resource groups or employee engagement groups or employee wellness committees, whatever the company calls it, honestly creating a safe space for employees to share concerns as to what their needs are, because that effectively drives what the programming and offerings and benefits should be. And if we meet those employee needs, we are going to support the reduction in stress. So, for example, if post-pandemic we hear that women in the workforce need better support in childcare, one of the ways we might reduce stress for a company is to add a childcare benefit. You know, the details of that would have to be figured out for each and every company. But it's really hearing employee needs right now and adapting to those and customizing solutions to meet those needs. When employees' needs are met, stress goes down. So there's no one and done solution. It's not one size fits all. And I really do challenge, I've spent many years in that programming space. I don't think half of what I did prior to the pandemic would work anymore. It's just different. So listening, hearing, adapting, innovating, creating, that is what the new employee wellness needs to be. And if you're meeting employees where they are, from my experience, you're effectively reducing their stress.
So like when we are talking about wellness programs, so according to you, what kind of wellness programs actually help like dealing with stress and preventing like employees from developing stress? What kind of wellness programs would definitely work in this case?
Well, it depends on the employee, because for some, worksite wellness yoga classes, whether it's by Zoom or in a little conference room for 15 minutes with an actual instructor, can be very impactful. We used to do these all the time, and employees would run down to a little conference room. We would move the chairs, and it was only 15 minutes, and it was the world to the 8 or 10 employees that came. Meditation moments, leading mindful moments and breathing, just an opportunity to have someone give you permission to breathe. Again, it can be over Zoom or in person. For some, I think getting outdoors, a walk and talk meeting, you know, like if Teany and I were colleagues and it was appropriate to say, let's walk and talk today for our meeting. Let's not sit in the office. Can we do this while we're walking? Find a safe space around the campus of the organization and go. We used to do that as well, and employees loved it. Some meetings, you don't need paper and pencil, right? Or a computer or a phone. You just need to speak to each other. So I think there's a lot of very simple things. I think one takeaway for all of the listeners would be customized solutions, but the other is less is more right now. So you don't need 30 minutes of something, 5 minutes of meditation, 5 minutes of chair yoga, 5 minutes of a little fit break with some music at your desk so you can stand up for a little bit and release your hip flexors and your low back and see your teammates laughing and giggling and dancing on screen. Those can have huge impact. So I'm super excited about where we are, because I think we have such opportunity to innovate and create some new programs, things we've never tried before, with music, and it could be coffee chats. You know, the world is our oyster to be creative, I think. So yes, there's lots of opportunity to create fun employee wellness activities to reduce stress in the day.
And if I can add one more thing to that, I think things that managers promote and participate in, where they walk their talk, is going to be really critical. Because we've had programs before, right? There's always been something, right? People weren't really doing it because it wasn't ever promoted. It wasn't emphasized at all. So I think the future is going to be adding things to meetings that happen day to day that managers also participate and promote, right? Because if you can see them doing it and they're actively participating in it, then you are likely to do it too.
Yeah, that's super powerful, Teany. Leading by example is everything. That is gold right there. You're absolutely right. A CEO that walks the talk, and each layer of the organization, it trickles down. If your manager is involved, a manager that's interested in wellness and participates, the likelihood of that team engaging is much higher. Yeah, that's exactly right.
Yes, like at the end of the day, it's the managers who every employee looks up to, right? So if they are doing those things, so the employees will also be inspired and motivated to do the same.
Yes.
And also like having employees request, right? You know, in corporate, I used to request things like, okay, listen, I need, to have every other Friday off. And in some companies do that. They allow for summer Fridays and, everyone's situation is a little different. So if you need to start work early and take an hour in the middle of the day to rest, relax, take a nap. I'm a big proponent of naps.
Me too.
And, it's not just in Spain and Europe, right? we all need rest. So, requesting things that maybe weren't done before, but that you need for your own sanity. That's great too.
Absolutely. So with this, we come to the end of the session. So Debbie and Teany, would you like to share some valuable suggestions with our listeners?
If I may, I think there's one thing that we haven't mentioned yet that I think is really important. Aside from having these programs, which I know Debbie and I have talked about, and we were actively supporting companies and management teams and things like that in creating these programs in their companies, but that's not the only solution, right? The big thing that we want to promote is also self-responsibility and really having people take more responsibility for their own lives and their own change and their own, whatever their needs are, because that's where it begins. Nothing is going to happen unless they start speaking and asking for what they desire. And, it's going to happen at the management level at work and things, but it's also going to happen at the personal level. And so aside from engaging with management and creating something in-house in your company, you can also seek support from people like Debbie and myself outside of work for your own personal life to help you figure out ways that you can create that lifestyle that really works for you.
Okay. I think I would I totally agree with Teany. And I think just following that thought, I think the takeaway for me, for the audience, would be it's never too late to begin. You may not have had a lot of wellness in your life ever, and it's never too late to start, no matter the circumstance, no age or shape or size, or you can always get started with little bits, 5 minutes of walking, breathing, outdoor activity, drink your water, all those things. It's never too late to start. And I don't think there's been a better time to prioritize our health and lean into just getting started, and baby steps can be huge, right? So it's never too late to make a step forward to being healthier, feeling better, all those things in our day-to-day life.
That's very motivating, Debbie. And Teany, thank you so much for joining me today on this podcast session.
Absolutely.
You're welcome.
And even I had learned a lot from this session. So I'm guessing our listeners will do as well. So thank you so much for joining, and hope to connect some other day as well very soon.
Yeah, we would love to come back. Just let us know.
Yes, sure. Thank you so much. Have a great day.
Thank you.
Thanks.
Thanks for listening to Vantage Fit Corporate Wellness Podcast. Please do subscribe to Vantage Fit Corporate Wellness Podcast on Apple Podcast, Spotify, and our YouTube channel for new episodes.